Am I audible and visible now here, everyone? I don't know. That's the very reason that we are having this class late. Pele was out, then had to make Kaira sleep, and then I was like, then only I can take this class. So I hope I'm audible and visible now, everyone. So, I wanted to deliver what I had committed, and that's the reason that we are here, even though it's late night. Kaira kahan se aayegi? Kaira so gayi. Okay. So, this is the session where we are going to discuss some cheat codes and some tricks on, when you don't know the answer in the exam hall, how you should logically guess the answer. Because trust me, I can tell you from my personal experience that it really, really works, and it helps a lot in getting those extra questions right. And also remember that you will not know answers to all the questions in your exam, be it rank 1 also. Nobody knows answers to all the 200 questions. It is the skills, the cheat codes, the tricks that really help in getting those extra questions right. So the questions I've included in this session are specifically the NEET PG PYQs only, so that you know that even in the actual exam, you can apply these cheat codes, like I say, the tricks that I say. Hai. So yes, we are going to have the sessions daily till your exam, at least till 20th to hone hi wala hai. This first session of the series we are doing here on YouTube live. The rest of the sessions, we will have the next session tomorrow at 11 a.m. and it is going to be in app, right? The Speed Medsynapse app. The next session tomorrow would be in app, right? So this is what we are going to do. Yeah, this will be available for later viewing as well. Okay, so let's start without any further delay, because I know that your time is very, very precious. So without wasting any time, let's start with this thing. Okay, let's start with this one. So identify, what do you think is this image showing? Right, I've just made a twist in this question here. Tell me, what do you think will be the answer to this one? No, not tired. It's just a camera effect. See, so that's what I have basically made a twist here. The twist is the options are the same, but the image is the different. And that is your first learning lesson. With every question, you are going to learn a lesson here that, remember, please do not read any question with a bias. Do not read any question with a bias. So this is a question that I'd seen in the PYQs when I'd solved, and the answer was glomerulus. So the answer here is glomerulus. Please do not do here. An examiner, if like me, will change the image and give you the same options. So you have to be very, very sure that you are reading the question right, you are looking at the image right, and you are reading every question without any bias, like a new question, not like a previously asked question, right? One bias here and there, one twist here and there, and the answer will change. So the question that was asked in your previous exam, the last year exam, there the answer was glomerulus, but here the answer is not glomerulus, right? Many of you have got it correct. This is pancreas. Okay, this is pancreas. So what do you see here is, हाँ नहीं रवि, ये pancreas ही है. तुमको preparation छोड़ने की ज़रूरत नहीं है, right? तुमको top करने की ज़रूरत है, छोड़ने की ज़रूरत नहीं है. So what do you see here is, this light area here in the image is, this is islet of Langerhans, the pancreatic islet that you are seeing. Why this is not a glomerulus? Let me show you the image of the glomerulus here. So look at this. This is what the glomerulus would be, with the Bowman space, the clear space that would be present. And look at the other, you are seeing the ducts, like nephron ke, you would be seeing the ducts with the khali lumen, right? So this is the lumen of the duct, the khali lumen of the duct that you are seeing here, and this is the glomerulus with the afferent, the efferent, and you will have this Bowman space present. You are not seeing that here. Even though this looks like, you might say that, ma'am, this looks like a Bowman space, but look at the adjacent structures. These are not the empty ducts, right? These are not the empty ducts, so this is not glomerulus. So this image is showing you, this is the islet of Langerhans, and these are the pancreatic acini, the endocrine and the exocrine part of pancreas. So this is pancreas. Okay, so the image here is pancreas. Let's have a look at the other images here. So look at this image here. What are you seeing? So again, you see something like the duct, the tubules here that you are seeing, but again, this is not kidney, because if you see that in between the ducts, right, in between these tubules, what do you have here? These are the Leydig cells, the interstitial cells of Leydig. Okay, the interstitial cells of Leydig, even that is asked as an image. So this is the image of testis, where you have the tubules, the seminiferous tubules are there, but then you have the interstitial cells of Leydig. So this is testis. Where you have this Hassel's corpuscle, right? This corpuscle wala image, Hassel's corpuscle, this is going to be thymus. Okay, this is going to be thymus, and this is the kidney. Okay, the glomerulus with the kidney, the ducts that you are seeing. Is this clear with everyone? Right? Is this clear with everyone? So first learning lesson, do not read any question with a bias. Oh, this is a previously asked question, and do not jump in your chair in the exam hall. The examiner definitely is going to put some twist like this. A paper which seemingly seems very, very easy actually has a lot of twist there. So please be very cautious of that. Okay? Please be very cautious of that. Okay, going to the next question here. This is your next. All these are the recently asked questions. Oh yes, this is for FMG students also. Please do not miss this session, the FMG students also. Injury at which of the following sites causes the failure of dorsiflexion? Right. So when you are given this image, this is your radiograph X-ray of the knee, and think very logically. Think very logically that the wider bone is going to be tibia, the patla bone is going to be fibula. So tibia is on the medial side, fibula is on the lateral side. So at least first you identify tibia and fibula. There is failure of dorsiflexion. So whatever has been asked, try to do it on yourself and understand what the question is asking. There is failure of dorsiflexion. So what is happening? The foot is always dropping down. There is a foot drop, there is no dorsiflexion. So this is a different way of asking. Basically, they are asking about a foot drop. Especially when the X-ray knee is given and they're asking you about some injury. Remember, the most common question asked is the foot drop. And remember, foot drop will be caused by fibula ka fracture. Okay, fibula neck fracture. Fibula neck fracture. I hope the Medsynapse users, the Pan India short users, you know the mnemonic for that is, okay, it is PED tip. Right? For those who do not know, this is your mnemonic. If you want to learn the mnemonic, PED tip is your mnemonic for peroneal nerve causes eversion and dorsiflexion. Tibial nerve causes inversion and plantar flexion. Inversion and plantar flexion. So loss of dorsiflexion means it is peroneal nerve which is gone. PED tip mnemonic is your most important mnemonic there. Okay? Going to the next one. Okay? Identify the marked region. I have not marked the region here. I will mark the region here. Identify the marked region in the given spirometry. What is this? क्यों insecurity हो रही है चीज? Identify the marked region. देखो, एक mnemonic रिवील करने से ऐसा नहीं है कि तुम्हारा रैंक कोई लेके चले जाएगा. ठीक है? God helps those who help themselves and God also helps those who help others. So, right, don't be very, very selfish ऐसे. Right. How will you rule out the options? For someone who is like, who's getting panicky in the exam, oh my God, I did not revise this image before the exam and I don't remember anything. At least use the logics and start ruling out the options. So learn the trick of ruling out the options. Now, when you are seeing in this image, is the image the arrow is marking to one volume or more than one volume? It is one volume or more than one volume. You are seeing 1 and 2 volumes together. It is not just one volume. So when it is not just one volume, what is it called as? A sum of more than one volume, 2 volumes, 3 volumes, 4 volumes, it is called as a capacity. Volume means only a single part is what will be shown here. So have you ruled out 2 options here कि ये tidal volume और expiratory reserve volume तो नहीं है, ये कोई capacity है, क्योंकि यहाँ पे 2 volumes add करके arrow is pointing to. If the arrow would have been in one area, in one area, in one area, in one area, then it would have been a volume. So you have ruled out 2 options straight away. Right, so now you have to choose only between the 2 options, functional residual capacity or is it expiratory capacity? The answer is going to be functional residual capacity. Residual means something which remains in the lungs. Another question, it remains in the lungs at the end of what expiration? Bada? It remains in the lungs at the end of what expiration? Normal expiration or forceful expiration? Normal or forceful? क्या है? It is at the end of normal expiration, right? So when the normal expiration is ending, what remains is FRC. When the forceful expiration ends, what remains is residual volume. We have discussed this. Forceful वाले के बाद जो बचेगा वो है residual volume. Remember, this cannot be measured here, right, with spirometry. ठीक है? Is this clear with everyone? Got the concept? Residual remains at the end of some expiration. Normal के बाद FRC और forceful के बाद बचेगा residual volume, right? All the Medsynapse users, you know the mnemonic liter, right? These are our 4 volumes from the top to the bottom. That is inspiratory reserve volume, tidal volume, expiratory reserve volume and residual volume. हमें ठीक है? Going to the next one. ठीक है? Going to the next one. Now see, this looks like a lengthy question and a complicated question, but actually it's a very, very easy question. So another learning point here, do not get frightened by the lengthy questions. Okay, do not get frightened by the lengthy questions. Actually, they are the easier ones than the one-liner questions. Okay? So, whenever you have lengthy questions, start reading from the last line first. Read the last line first to understand what is this question about. Okay? So, which of the following is true about surface tension and compliance in this baby? And then you read the second last line. If the last line is not giving you the crux of the question, you know that it is asking about respiratory distress syndrome, right? That is how you save time. So, respiratory distress syndrome, think very logically, respiratory distress syndrome, there is no surfactant. Premature baby, no surfactant. So, what will happen? Collapsed lung hoga. I hope you know that it is decreased volume of the lungs. What do you get on X-ray is bilateral whiteout lungs with air bronchogram sign. So, collapsed lungs, that means the compliance is less or the compliance is more. The compliance definitely is decreased. The compliance is decreased. So, you are ruling out option A and option C. You have again ruled out 2 options. You know, ruling out is the main MCQ cheat code that you should learn. How do I rule out the options? So, compliance is decreased. Now, I have to decide whether surface tension is increased or surface tension also is decreased. So, no surfactant means the surface tension is increased. Surfactant decreases the surface tension, right? It prevents the collapse because of that. When the surface tension increases, the alveoli would collapse. Okay, the alveoli would collapse. So, please remember that the role of the surfactant is to decrease the surface tension in the alveoli. If the surfactant is not there, the surface tension will increase. Okay, the surface tension will increase. What pneumocytes produce the surfactant? What pneumocytes? ठीक है सुमित. What pneumocytes? It is type 2 pneumocytes. Another question asked, it is type 2 pneumocytes which produce the surfactant. Okay, it is type 2 pneumocytes. ठीक है? Going to next one. See, this is an example of a question जो हमने discuss नहीं किया है. And let's say you have not read about this anywhere. So, how will you guess the answer, right? The next cheat code is decoding the terms in the exam, right? If you are seeing any new term, how will you decode that? तो मुझे बताओ इसका आंसर क्या होगा? What will be the answer to this one? In which of the following reflexes gastric emptying is delayed when the acidic content enters the duodenum? So think logically. This is the acidic content entering the duodenum and then it is delaying the gastric emptying. So something coming into the duodenum and then it is sending that negative signal to the gastric emptying. So what reflex is that? Is it gastrocolic? मतलब stomach से colon पे जा रहा है. Enterocolic, entero means small intestine to colon. Gastroileal or enterogastric. So what is the direction it is going? From the duodenum, the stimulus is then going to the stomach to inhibit the gastric emptying. So logically thinking, I can mark the answer as enterogastric. So from the duodenum, the signal is going to the stomach. So remember, it is entero, that is duodenum is sending the signal to the stomach. So even when I have not read this term, I will be able to answer that it is enterogastric. What is gastrocolic reflex responsible for in a newborn, in an infant? What is gastrocolic for? Gastrocolic. स्टमक से जा रहा है कोलॉन में, तो उसमें क्या होता है कि स्टमक में जैसे ही बेबी को फीड करते हैं कोलॉन में सिग्नल जाता है और डिफिकेशन होता है, राइट? सो डिफिकेशन आफ्टर फीडिंग व्हिच इज कॉमन इन द न्यूबॉर्न, सो दैट इज व्हाट इज गैस्ट्रोकोलिक, राइट? डिफिकेशन in the newborn, that is gastrocolic. Okay, after eating. Is that clear? So this is how you decode the terms. This is another cheat code that you have to learn, right? The skill that you have to learn. Coming to the next cheat code wala question. This question looks like a difficult question. Imagine this has come in your exam and looking at the options you are like पता नहीं ये क्या पूछ लिया है physiology में से, है ना? So yes, CPDA is superior to ACD for blood storage as. What is going to be the answer to this? What is going to be the answer to this one? Now they have given you in the question itself that CPDA ACD से superior है blood storage के लिए. So obviously what option do you rule out? Decreased release of oxygen नहीं करेगा. It is increasing the release of oxygen, and that is why it has to be superior. So logically thinking, a blood, right, hemoglobin which will give more oxygen to the tissues is going to be superior. So I have ruled out the first option, right? Ki this is not making sense and not correlating with what the question is saying. Next one, it has less P50, less acidic, and fall in 2,3 BPG is less. Now first of all, tell me that when I say it is less acidic, what shifts the oxygen dissociation curve to right? Acidosis or alkalosis? It is acidosis, right? Remember acidosis, D for dextro shift, alkalosis, L for left shift. And what releases more oxygen? Dextro matlab right, releases the oxygen, right? So again, if this has to make sense, it should not be less acidic, more acidic, so that the release is more. You want the blood to give more oxygen. So this is ruled out. Now coming to the concept of P50. P50 is the PO2 where the hemoglobin is 50% saturated. Where do you denote the PO2? On the x-axis, saturation on the y-axis. So when it is 50% saturated, how much is the PO2? So look at the graph here that you have. So in this graph, this is 50% saturated as the curve is shifting to right, right? This curve P50 is this much, right wala curve, the P50 is this much. So as the curve is shifting to right, what is happening to the P50? The P50 is increasing. Less P50 means left shift. You are not talking about left shift, you are talking about right shift. Okay, so this is also out, right? This is also out. So obviously now you have ruled out the three options. What is remaining is fall in 2,3 BPG is less. That means it has more 2,3 BPG. Remember the mnemonic, all the raised values cause right shift, except all the raised values cause right shift, except decrease in what causes right shift? Decrease in pH, that is acidosis. Otherwise, all the raised values, increase temperature, increase 2,3 BPG, increase H plus, reduce affinity and right shift. Is this clear with everyone? This is absolutely a PYQ. All the questions which I am showing you are the PYQs. So trick learn kar liya yahan, rule out the options. Rule out the options. When it is saying it is superior, that means it is more release of oxygen. That means it is rightward shift and not leftward shift. Increase in 2,3 BPG will cause the rightward shift. Chalo, next kare. Going to the next one. Okay, this is your next question. Again, let's say an example of a question. Yes, Avin, anemia causes right shift. Next question, suppose where you do not know the answer, how will you guess the answer? Which of the following is the investigation of choice? Always read the last line first in your lengthy questions which are not one-liner. Sewage worker diya hai, abdominal pain, jaundice whenever given with conjunctival suffusion. What do you think of jaundice or conjunctival suffusion साथ में दिया है तो sewage worker, you are thinking about leptospirosis, right? Remember the 3 R's, rats, rains, rice field. This is leptospirosis. Now suppose you do not know leptospirosis के लिए directly क्या use करते हैं, but at least you rule out the options. Vidal test everybody knows is for typhoid. I don't know microscopic agglutination, let's say. Wheel-Felix reaction. We have read Wheel-Felix reaction in rickettsia. Which was the specific one that we have seen, which is OXK positive. The short students, which is OXK positive. Remember OXK. K is scrub typhus. Scrub typhus is OXK positive. Okay, scrub typhus is OXK positive. And you have Paul Bunnell test, which is done for infectious mononucleosis. This is done for infectious mononucleosis. तो ये आपने कहीं ना कहीं पढ़ा है for a particular disease. So ruling out the option, the answer will come to microscopic agglutination test. Okay, the MAT test, the microscopic agglutination test, which is going to be the answer by ruling out the other options. Okay, by ruling out the other options. ठीक है, Paul-Bunel test is a heterophile antibody test which is used for infectious mononucleosis. Okay, which is done for infectious mononucleosis. ठीक है, done with everyone. Going to the next question. Again, a question which looks lengthy with the difficult options, but actually it is easy. Learning point, do not get panicked just by looking at the length of the questions and the options. You have the tricks hidden there, right? It is not very difficult. इसका आंसर बताओ क्या होगा? Okay, what is the diagnosis given here? Now the question is, what is true about the causative organism? Always read the last line first to understand कि ये कौन से subject, कौन से topic में से question है. तो ये कुछ microbiology related है. Then you read the second last line. The second last line tells you CSF culture shows gram-negative bacilli. It is showing gram-negative bacilli. Now I don't know what the condition is about. Then I see there is something related to CSF. There is neck rigidity. So that clicks the bell in the mind telling that this question is something related to meningitis and the organism is gram-negative bacilli. Now bacitracin sensitive. Bacitracin test, bacitracin sensitive. Remember that flow chart of gram-positive cocci that we have discussed. This is done for streptococcus, right? This is done for streptococcus. Which streptococcus? Remember B for B. Beta hemolytic streptococcus. B for B, beta hemolytic streptococcus. Can you tell me which is sensitive? Which is bacitracin sensitive? Remember P and P. Streptococcus pneumoniae, Streptococcus pyogenes, optochin sensitive, bacitracin sensitive. So I hope all of you remember from our short classes that it is Streptococcus pyogenes, right? So ये तो out हो गया. Exhibits alpha hemolysis on sheep blood agar. This is also alpha hemolytic Streptococcus viridans और वो सब वाला. तो ये भी Streptococcus तो gram positive है. इन्होंने बोला है gram negative, तो ये भी out हो गया. Streptococcus तो gram positive है. Next one है exhibits satellitism around Staph aureus. What was the mnemonic? Satellitism. What gets influenced by Staph aureus and rotates around Staph aureus like a satellite? Influenced is influenzae. Hemophilus influenza B. Right? Remember, whenever you are given meningitis ka question, you think of Neisseria, you think of Hib, you think of Listeria, right? And you have E. coli vagera there. But here it is pleomorphic gram-negative bacilli. This is Hib. So remember, this is satellitism. Non-lactose fermenting colonies, lactose fermenting colonies, you talk about E. coli, Klebsiella, Salmonella, Shigella, Pseudomonas, unko differentiate karne ke liye, right? So remember, which ones are the lactose fermenting, guys? Which gram-negative bacilli are lactose fermenting? याद है mnemonic lactose fermenting कौन सा था? E. coli and Klebsiella. Okay, E. coli and Klebsiella, these are lactose fermenting. Okay, this is lactose fermenting. Is this clear with everyone? E. coli and Klebsiella. ठीक है. So this is Coxsackie वगैरह तो वो तो viruses में आ जाएगा ना. अभी आपको bacteria दिया है तो we'll talk about bacteria. So remember, whenever it is meningitis, you talk about Neisseria and Hib very commonly and Listeria very commonly. In the neonate, it is group B Streptococcus. Let me write down here because this is very, very important. So when you have meningitis in the newborn, E. coli is important and other two important is group B Streptococcus and Listeria. What will be given for Listeria? It is gram-positive bacilli. Group B Streptococcus, Streptococcus agalacti, it is gram-positive cocci. What is the drug of choice for Listeria? The drug of choice for Listeria is ampicillin. Okay, Listeria uses those actin filaments wala, rocket tails banata hai, goes from one cell to the other, rocket tails. Holo positive, H. pylori. है ना नवराज, होलो पॉजिटिव urease positive, oxidase positive, catalase positive, all positive. H. pylori. Remember HP, H. pylori is holo positive. That was our mnemonic. Okay, H positive, holo positive. Okay, is that clear? Chalo. Going to the next question to learn another cheat code, which is enzyme which is activated by decrease in insulin glucagon ratio. Which enzyme is activated by decrease in insulin glucagon ratio? Now, whenever you have question like this, the cheat code that you have to apply here is find the odd man out. एग्जाम में ना पैनिक स्टेट याद नहीं आ रहा है कि इंसुलिन क्या करता है, ग्लूकागॉन क्या करता है. डू नॉट वरी, लुक एट द ऑप्शंस. हेक्सोकाइनेज, ग्लूकोकाइनेज, फॉस्फोफ्रक्टोकाइनेज एंड ग्लूकोज 6 फॉस्फेटेज. कुछ भी अगर समझ नहीं रहा है तो सिर्फ ऑड मैन आउट कर लेना कि ये भी काइनेज है, ये भी काइनेज है, ये भी काइनेज है. काइनेज 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 एक साथ चले गए. जो ऑड मैन आउट है ग्लूकोज 6 फॉस्फेटेज, उसको आंसर मार्क कर देना. ठीक है, सो ये एक ऑड मैन आउट आपको फाइंड करना है. ठीक है, so remember the concept here basically is decrease in insulin glucagon ratio means decrease in insulin. That means it's a catabolic state or an anabolic state. Insulin comes in fed state. No insulin, decreased insulin, this is catabolic state. Glucose 6 phosphatase, breaking down glucose 6 phosphate. This is the enzyme of your glycogenolysis, gluconeogenesis, common enzyme. It is deficient in what condition? Von Gerke's disease. Von Gerke's disease is where it is deficient. So remember, odd man out. बाकी तीनों kinases हैं, हमारे glycolysis वाले enzymes हैं. Odd man out है glucose 6 phosphatase. Can you tell me whether pyruvate carboxylase will be activated or it will be deactivated by decrease in insulin glucagon ratio? Pyruvate carboxylase. Thank you, Sumit. Badao. Oh yes, this is for FMG also, guys. Pyruvate carboxylase will be activated or deactivated. Activated or deactivated. So for this, you need to know that pyruvate carboxylase is the enzyme of gluconeogenesis, which is catabolic state. It happens in the fasting state. So even this will be activated. Decrease in insulin will activate the catabolic ones. Okay? Decrease in insulin will increase LPL or HSL, lipoprotein lipase or hormone sensitive lipase. Which one will it activate? Decrease in insulin will increase lipoprotein lipase or hormone sensitive lipase. Very good. So, right, remember insulin, L for L. Insulin loves L for L. LPL loves LPL. H for H hates HSL. जब insulin बढ़ेगा साथ में उसका प्यार, the LPL will increase. When insulin will decrease, the HSL will increase. It will increase the hormone sensitive lipase, which causes lipolysis. What will it do to acetyl-CoA carboxylase? What will it do to acetyl-CoA carboxylase? Increase or decrease? Increase or decrease? Acetyl-CoA carboxyl group add करके क्या बन रहा है? It is making fatty acid. It is making fatty acid synthesis. So this is anabolic. This is going to be decreased. This is going to be decreased. Decrease होगा भाई, decrease होगा. Because it is synthesis, it is anabolic. Okay, pyruvate carboxylase will increase, but acetyl-CoA carboxylase will decrease because it is fatty acid synthesis. Okay, so understand this concept. This is what we have discussed in biochemistry as well. Okay, we have discussed this in biochemistry. Okay, going to the next question. True about non-competitive inhibition. True about non-competitive inhibition? Yes? Very good. The answer is going to be B. Now, true about non-competitive inhibition, let's say you forgot to revise this topic again before the exam and you have to just rule out the options. Now, rule out the options when it is Vmax. Vmax is telling you that it's a maximum velocity possible. So, can the Vmax increase beyond that point? No, it's already the maximum. So is the increased Vmax possible? Not possible. Increased Vmax? Not possible. So option A and option D is ruled out because it's already the Vmax. उससे ज़्यादा वो बढ़ नहीं सकता. Vmax can decrease but Vmax cannot increase. So option A and option D are ruled out. Next is a constant Km or a decreased Km. Decreased Vmax तो यहाँ पे है. Constant है कि क्या है? Remember in competitive, non-competitive inhibition, one changes and the other remains a constant. If Km changes, Vmax remains constant. If Vmax changes, Km remains constant. So decreased Vmax along with that will be the constant Km. Okay, along with that with the constant Km. Is this clear for everyone? Okay, okay, you only tell me what is the mnemonic for this. Non-competitive. No KMII increasing, right? No KM increasing in non-competitive. In competitive, KM increases. In competitive, KM increases. What kind of graph will you have in non-competitive? Non-competitive N wala, it will have this V-shaped Lineweaver-Burke plot. The Lineweaver-Burke plot will be this V-shape. Okay, will be this V-shape is going to be non-competitive. The Lineweaver-Burke plot where you have the crossing lines, C for C is going to be competitive. Okay, C for C is going to be competitive. और मुझे बताओ कि अनकॉम्पिटिटिव में क्या होता है. हमारा अनकॉम्पिटिटिव का एग्जाम्पल क्या था? पैन इंडिया शॉर्ट क्लास में डिस्कस किया था. अनकॉम्पिटिटिव का एग्जाम्पल क्या था? द मदर इन लॉ हु इज वेटिंग फॉर द सन टू गेट मैरिड and then this inhibitor mother-in-law will get activated. So it binds to the enzyme substrate complex and inhibits that. So actually it increases the rate of the reaction. It increases the rate of reaction. Uncompetitive makes everything go under. Decreases the, ये क्या हो गया? Decreases the Km, decreases the Vmax. It decreases both. Okay, decreases both. ठीक है. So remember it decreases both. That is what was your mnemonic for the uncompetitive. And the Lineweaver-Burke plot in uncompetitive, remember un is two parallel lines. U has two parallel lines. This is uncompetitive inhibition. Uncompetitive inhibition. ठीक है. ठीक है everyone. Going to the next one. Okay, this is your next question. Pseudo P pulmonale is seen in which electrolyte abnormality? Pseudo P pulmonale. Pseudo P pulmonale is seen in which electrolyte abnormality? Yes, this video will be available. Right. The best part here is you do not have hypokalemia and hyperkalemia both together. Remember the P wala is something related to potassium ka change, because hypocalcemia, hypercalcemia cause what change? What do they change? Calcium is responsible for contraction in the heart. That is the QT interval, right? The action potential causing contraction. Hypocalcemia, decrease in calcium, everything will be slow in the heart. It increases the QT. Hypercalcemia will decrease the QT. Hypocalcemia, increased QT always predisposes to torsades de pointes, for which the drug of choice is IV magnesium sulfate. What is the drug? What is the effect of digoxin on QT? QT, choti. Digoxin causes QT, choti. Decrease in QT is seen with digoxin. Okay? So remember that the answer here is hypokalemia. How do you remember for hypokalemia? Remember first is underkalemia. Okay, underkalemia, UK has U wave. Where do you see U wave? In underkalemia, hypokalemia. Second, with hypokalemia, what will happen to the T? Potassium down, repolarization down, T goes down. Opposite of that will be P going up. So pseudo P pulmonale means the P is going up. So remember, it is the opposite change in the T. That is the T going down. That is the potassium going down. It is hypokalemia. So please remember underkalemia, and you have pseudo P pulmonale in hypokalemia. What do you see in hyperkalemia? Tall tentate T wave and sine wave pattern. Remember, sine wave IN is seen with increased potassium. The sine wave pattern, the very broad QRS sine wave pattern is seen with hyperkalemia. ठीक है? Is this clear with everyone? So remember, the change in the T and the P is opposite. When the T is increasing, P going down, T decreasing, P going up. T decreasing is hypokalemia. T decreasing is hypokalemia. Okay? Okay, next one, and I believe this is your last question for the today's cheat codes. We are going to have the next session of these more cheat codes and tricks for your PYQ discussions. Tomorrow 11 a.m. we will have the next session in the app. ये लास्ट है, ठीक है? बताओ इसका आंसर क्या होगा? अगेन ये क्वेश्चन देख के डर मत जाना एग्जाम में, ओ माय गॉड व्हाई डिड आई नॉट रिवाइज बार्टर्स एंड गिटलमैन्स बिफोर द एग्जाम, आई शुड हैव डन दैट. मुझे लग ही रहा था इसका क्वेश्चन आएगा. A 35-year-old female patient has hypokalemia, hypertension, and metabolic alkalosis. What is the most likely etiology? So somewhere, if you do not remember the entire thing, at least you will remember something like Barter's or Gittelmann's. हमने ऐसा कोई syndrome पढ़ा है कि भाई जिससे this is similar to some diuretic. Which one is similar to loop? Which one is similar to thiazides? I might get confused. But at least I remember that these two syndromes were related to some diuretic. Now, will diuretic drug cause hypertension, or do we use diuretics in hypertension? Diuretics are used to treat hypertension. So, there will be no hypertension here in Barter's and Gittelmann's. So, this is going to be out. This is going to be out. Fanconi is something that we know is related to the PCT reabsorption getting affected. There is phosphate urea, glucose urea, सब कुछ ग्लूकोज में बाहर जा रहा है. उसमें कोई हाइपरटेंशन वाली बात हम नहीं करते हैं, तो ये वाला ऑप्शन भी रूल आउट कर लिया. सो जो ऑप्शन बचेगा, एक ही ऑप्शन बचेगा, वो रहेगा लिडल्स. ओके, वो रहेगा लिडल्स. सो एटलीस्ट रिमेंबर बार्टर्स एंड गिटलमैन्स इज रिलेटेड टू द डायूरेटिक. बार्टर्स इज रिलेटेड टू Barters, bar होने वाला. A song which you listen to bar is on a loop. So remember, Barters is bar loop diuretics wala. Sodium potassium 2 chloride channel wala, loss of function mutation. So Gittelmann becomes your thiazides. Okay, Gittelmann becomes your thiazides. Liddle. Liddle is a riddle. What is the riddle in the liddle? Liddle has features like increased aldosterone, but without increased aldosterone. Features है increased aldosterone के. Increased aldosterone causes hypertension. So there is hypertension, but when you see the aldosterone levels, they are not increased. It's basically because of ENaC, gain of function mutation. So what is the drug of choice for ENaC? Which is the ENaC inhibitor? Amiloride. So the drug of choice in Liddle's is amiloride. Okay, that is amiloride. Okay? Is this clear with everyone? Right? So this is a riddle in the liddle. The aldosterone is not increased, but there are features of increased aldosterone. So it has low renin, because the features are of like high aldosterone. So renin का कोई काम नहीं है. हमें renin, angiotensin, aldosterone नहीं चाहिए. So it will be low renin. Okay, it will be low renin. And remember, there is hypokalemia. Please never forget this mnemonic of your aldosterone. Aldosterone causes alkalosis or acidosis. Aldosterone, AL causes alkalosis. Alkalosis is all K loss. Alkalosis is all K loss. There is going to be hypokalemia. Okay, so there is hypokalemia, there is hypertension, and there is alkalosis. All are the features of increased aldosterone. Features of increased aldosterone is Liddle syndrome. Okay, that is Liddle syndrome. Okay? Is this clear with everyone? Right? So this was a quick discussion on basically your cheat codes, the tricks, and how you apply all the mnemonics that you have learned in the short classes in the Medsynapse app. And I hope this will give you the confidence that whatever I have learned, the tricks that I have learned, are definitely going to help me in the exam. Please revise it so that it has to go into your subconscious mind. All the tricks and the mnemonics, they are going to be your big time saver in your exam. Okay? So the rest of the sessions we will have from tomorrow in app. Right? The Medsynapse users are getting very insecure कि मैम सब कुछ YouTube पे मत बता दो. So the Speed Medsynapse app is where we are going to have the rest of the sessions. And tomorrow 11 a.m. you will have a similar session there, okay, where we'll discuss the questions. Okay, So yes, I'll keep adding on some more questions also apart from PYQs in the sessions. Okay? Thank you so much everyone. In these last days, just focus on revising the PYQs, the related topics, and the short, all the tricks that we have learned along with the binge videos, right? The Pan India short classes and the binge videos. Okay? So goodbye everyone. Thank you so much, and I'll soon be posting a video on how many to attempt in your NEET PG exam. That's another most frequently asked question. So that would be the next video also coming up on this YouTube channel. So make sure you are subscribed to this so that you do not miss on that information where I tell you, how many to attempt and how to attempt. Okay? Goodbye, take care, and keep studying, keep revising, keep Medsynapsing, and keep winning everyone. Thank you so much. See you tomorrow at 11 a.m. in the Speed Medsynapse app.